start. This is the Clinical Consultation Network. We do this every Tuesday at 1:30 p.m. Central Time. And so what we basically do is take a case and we break it down, try to understand it better, maybe try to provide some input if that seems appropriate. But, we basically want to understand more about the clinical nature of different situations that we're dealing with out there. And you've got a very interesting case today. So who we have with us is Pam Odom, who's a nurse from West Tennessee Family Solutions. And I'm your host, by the way, Bruce Davis. I'm the Deputy Commissioner of Clinical Services for the IVD.
Okay.
And my co-host today is David Taylor, who is the Director of Nursing for the department as well. So we'll be here to help you and guide you and probably ask a lot of annoying questions today.
Okay.
So, Pam, it is great to have you here today. And could you start us out just by telling us a little bit about yourself?
Sure. I'm an LPN, and I've been a nurse since the late 70s. And I am new to this field approximately 17 years ago, about 9 months after WTFS opened. And I really didn't know if I would like this type of nursing, but they reeled me right in. I love it, and I've been here that whole time with the exception of 2 years that I did move, and even then, though, I did a little part-time work for them, and then I came back full-time a few years ago. And the nurse that's sitting here with me today, Kathy Whitten, she retired. She took my position when I left. She retired. I came back, took her position, and now I pulled her out of retirement, and she's here part-time.
Okay.
So I'm really blessed with the people I work with. On a personal note, I just celebrated my 43rd wedding anniversary.
Wow. Fantastic.
Yeah, so that's great.
That's amazing.
I love this field, and I've watched us grow. When I came here from 7 patients to now I think we're 69 now.
Yeah, I have always had a curiosity, though, Pam. That's an impressive 43 years. That's impressive because I was bragging about I've been married 35 years, but you got me beat by 8 years, sir. So that's really great. The question I have is on the naming of WTFS. Who was responsible for that name?
Our board members,
Okay.
Carolyn and Dick Johnson, they were the ones that got this company started, and they were the ones that named it that. It's just fit us, it seems like.
Yeah. So, it just, every time I always have to kind of stop myself and think, okay, WTFS, what does that mean? And then, so thank you for clarifying that. You've got a great, I don't want to say it's certainly not a great circumstance for this man, Ronnie. And so we're going to call him Ronnie today. That will be his pseudonym. And we want to try to stick to that pretty closely because we don't want to violate any confidentiality through this discussion. So if you could just tell us a little bit about Ronnie today, that would be good. You might want to repeat that. You may just want to repeat that to yourself a couple times just so you don't forget.
Ronnie, I've got
it. Yeah, there you go. There you go. That's that. And so tell us a little bit about Ronnie's case and the relevant factors associated with that.
Well, approximately July the 19th, he had a sort of a sudden onset of an altered mental status. And it sort of snowballed after a few days, but the staff started noticing it then. And then on the 24th, the nurse went out to see him and really saw a significant change in his mental status, to include, which was highly unusual, incontinence, even of bowel and bladder.
Okay.
So it was a big, big change for him, having difficulty remembering, what to do next. And that wasn't him. He's a very routine type person.
Okay.
And, yeah.
Any other particular characteristics of the decline, like self-care, ability to...
Yeah, he did not remember how to brush his teeth. He had to be shown again, hand over hand, how to brush his teeth, which that was an independent activity that he did before.
Okay.
He would get up from the table. He always took his dishes to the sink, and he would have to be prompted to do that. It was just every day that's routine for him. Everything that was routine, he forgot that he had to do it. When he would get up and eat breakfast in the mornings, he would go back to the bedroom to go back to bed. He did not know it was daytime, time to get up and move.
Okay. That's good. You can proceed now. And we'll probably interrupt you a few times throughout.
That's fine. He's 54 years old, and I'm sort of following that outline since this is a new thing for us.
Sure. Feel free.
Something we see as a real strength for him, he smiles beautifully, lights up the room. He's affectionate. He still has some independence in his activities of daily living, and like Kathy mentioned, clearing off the table. He loves to carry his own backpack, and he always wears a ball cap. He communicates by signs and gestures, and he's been fairly healthy until, all of this has started.
Yeah.
And his seizures are well controlled. Keeps all his medical appointments, and he has a good intake, his weight's stable, and he loves puzzles. He likes to string beads, and he loves to have his head rubbed and his hair brushed.
Okay, and so these are all things that he still does now. I mean, so he's still smiling and affectionate. He's still wearing his ball cap. All of these things
yes,
that you just said.
He has improved now. He is a little better now, so he is back to most of these things.
So he's come back to it. So he had, at some point here after April, was it April 19th? Is that what I heard?
No, July.
Okay. Totally off base there. Okay, July 19th. So he had this decline, but then now you're starting to see some of it come back a little bit now? Is that what I'm understanding?
Yes.
Okay.
Yes.
Okay.
We've been talking with the staff on a regular basis, so we're keeping up. And these are people that most of them have been working at that home a long time, so they know him very well, which is a plus.
Pam, didn't he also have a lot of self-injurious behavior or some behavioral concerns?
Yes. Too? Yes, definitely.
How's that been affected?
All of it's better. The behaviors have totally went away.
Mm-hmm. Yep, the behaviors have totally went away. Whenever he was going through this process, that whatever the mental status change was, his behaviors, he became very meek and mild. He would tolerate an X-ray. He would lay there for an MRI. He would do everything that you needed him to do. And before, he would not do that.
Okay. So, and let me make sure I'm understanding, especially particularly what behavior you're talking about. So you're talking about like resisting different activities or not wanting to participate or that kind of thing, or are you talking about aggression, self-injury?
Yeah, he has no aggression, no self-injury, none of that, and he also would participate in the medical procedures that needed to be done.
Okay, but the aggression and self-injury, my understanding had been, because I know a little bit about this person, that he had not really done those to a high degree even before this, right? Or I mean, it was well in his past that he... Go ahead.
Yeah, it was in his past. He had a long history of engaging in self-injurious behaviors to the point that, he was in a helmet for a long time.
Yes. But he had gotten independent of the helmet.
Yeah.
So what we're talking about is kind of putting everything in perspective. A long time ago, he had pretty severe head-banging behavior. More recently, that had pretty much diminished. And correct me if I'm wrong.
Yes,
And then
correct.
so then this period where he had after